Happening now, 3 new cases of COVID-19 were reported yesterday here in Chautauqua County. We'll have the details. Plus, Cattaraugus County's Public Health Director joins us with the latest on the COVID-19 outbreak there, and some late-breaking news in regards to when schools will reopen here in New York State.
And the rain has all ended for today, and the weekend will be better. We will talk about it as I have the full forecast details coming up as the news at noon starts right now.
Live and on demand, this is WNY News Now.
And thanks for joining us for WNY News Now on this Friday. I'm Justin Gould. We start with some breaking news. New York State Governor Andrew Cuomo, literally just minutes ago from our noon broadcast, announced that schools here in New York State will not reopen for the rest of this school year, which for many districts goes until the middle of June. The governor made his comments during his live New York State press briefing update just moments ago. He says that there's still a little bit of uncertainty in regards to when schools will reopen next fall, and that when we get to that point, the state will work with school districts to come up with a plan.
There is no decision on the fall because the fall is a long time away.
When will schools start to have to be submitting their plans by?
It depends when they're going to open, but they should start preparing their plans now because this is going to be a real exercise. You know, we're talking about how manufacturing companies socially distance, how construction companies socially distance. How does a school socially distance? You know, this bizarre setup here, right? Look at this room. How do you run a school like this? How many more rooms would you need to do this? How many more buses do you need to socially distance on a bus? You know, how about a cafeteria? There's a whole set of questions. How about a dorm room? So they should start working on those plans now.
How do you ensure that free and available?
Meanwhile, Pennsylvania state officials announced that some counties will begin to reopen as soon as next week. That includes Warren County, Pennsylvania, who announced that May 4th will be the first day their government office buildings will reopen. We have news reporters in our newsroom right now working to learn more about how this affects people there in Warren County, Pennsylvania. And you can follow the latest on our mobile app and WNYNewsNow.com. Well, 3 new cases of COVID-19 were reported here in Chautauqua County yesterday. Health department officials say the cases involves a woman in her 30s and 2 women in their 60s. There are now 7 active cases that continue to recover in quarantine. A total of 35 people have been infected with coronavirus. 26 have recovered, and 3 have died in relation to the outbreak. Meanwhile, in Cattaraugus County, a woman living in the northwest corner who was asymptomatic, meaning she had no fever, no cough, no shortness of breath, no body aches, has tested positive for coronavirus. Officials say she denies coming in contact with any other active case. Since testing positive, she and her family have been quarantined. Contact tracing is now underway. Now, later this afternoon, Chautauqua County health officials are scheduled to hold a 3 p.m. press conference update, which you can watch live right here on WNYNewsNow.com. Well, 3 drive-through COVID-19 testing clinics will be held next week for essential healthcare workers, first responders, and child care center staff here in Chautauqua County. Chautauqua County officials say that the COVID-19 infection testing will determine if residents have coronavirus in their system at the time of testing and is not antibody testing. Test samples will be analyzed at a New York State licensed laboratory, and results are expected to be available within 24 to 48 hours. Now, drive-through testing will take place at the Chautauqua Lake Central School bus garage on Tuesday, May 5th from 3 to 7, Thursday, May 7th from 11 to 3, and Saturday, May 9th from 8 to 12. Those interested in booking an appointment are asked to pre-register. We have links on how to do that at WNYNewsNow.com and on our mobile app. Well, more than 100 teams across the world are racing to develop a coronavirus vaccine. Medical correspondent Elizabeth Cohen explains there's a chance the United States could have one by January.
Okay. Scientists from around the world have begun testing their experimental COVID-19 vaccines in people. Historically, it's taken years to do human clinical trials and get vaccines approved. For polio in the 1950s, it took about 3 years. It took about that long for the rubella vaccine in the 1960s, and it took 2 years for mumps. But no one wants to wait years for a vaccine for the novel coronavirus.
I hope we're going to have a vaccine, and we're going to fast track it like you've never seen before.
And there are reasons to be hopeful. Researchers are moving with lightning speed, with more than $1 billion in projected investments already pouring into the effort. And the U.S. Food and Drug Administration, which will need to approve the vaccine, has been moving faster since the pandemic began. And the effort is quickly growing. As of April 26th, 89 teams internationally were working on vaccines, according to the World Health Organization. 4 days later, the WHO listed 102 teams working on vaccines. That's 13 more teams in just 4 days. 7 are already in human trials. Of those 7, 3 are led by teams in the U.S., 1 is headed by the National Institutes of Health outside Washington, D.C., another by Inovio, a biotech company with research and development in San Diego, a third by pharmaceutical giant Pfizer, headquartered in New York City. Another is in England at the University of Oxford. 2 are in China, 1 in Beijing, and 1 in Wuhan, where the pandemic began. Human trials began a month and a half ago, with the NIH first on March 16th. Pfizer and Oxford are the most recent. They started human trials April 23rd. Who finishes first is anybody's guess. Thursday at CNN's Coronavirus Town Hall, Dr. Anthony Fauci said getting a vaccine on the market by January could happen. Vaccine trials are notoriously unpredictable.
What might happen is that people months from now will say, well, you said we were going to have a vaccine in January. I didn't say that. I said we're going to shoot to be able to have one if we're successful at each and every one of these places.
It might turn out that a promising vaccine doesn't work.
Believe me, there's nobody in the world, no matter what they say, from what country, that's going to guarantee you that they're going to have a safe and effective vaccine at any given time frame. They may be cautiously optimistic about it, but nobody's going to guarantee that.
Or worse, that it causes harm.
There are a number of situations there that could go wrong. Like it may all of a sudden have a safety signal. Oops, we have a problem.
Fauci suggested that to save time, the U.S. could manufacture some vaccines even before they have full results of clinical trials. Financially risky, but he said a risk that's worth it, given what's at stake.
Elizabeth, thank you. While top infectious disease expert and Dr. Anthony Fauci is optimistic, he admits that target dates are not set in stone yet. Well, Pennsylvania Attorney General is making a historic argument next week to challenge the Trump administration's rules allowing employers to deny contraceptive coverage to employees based on the employer's religious beliefs. Well, WNY News Now attended AG Josh Shapiro's teleconference yesterday, in which he talked about the case, and his staff will argue over the phone because of the COVID-19 outbreak. Shapiro says that it's imperative for his staff to hold the Trump administration accountable in its policies on contraceptives, healthcare as a whole.
We cannot, in good faith, allow for federal agencies to dismantle laws they don't like and don't have the votes to change. Allowing employers to dictate how and for how much you can receive your birth control aims to systematically break the law. The will of the people ensured that everyone in this country will be provided with affordable health care and access to treatment.
Shapiro tells WNY News Now that New York State Attorney General Letitia James and her staff provided what he says is much-needed support during preparations for the case. Well, a rally protesting government restrictions surrounding the COVID-19 pandemic is scheduled to take place today here in Jamestown. This is part of a statewide protest dubbed Rally to Free New York, hosted by the Community Outreach Initiatives and the Constitutional Coalition of New York State. Garrett Kane is a spokesperson for the Jamestown's event. He says the executive order requiring all non-essential businesses to close, banning non-essential gatherings of individuals of any size for any reason, directly violates our rights.
We're not so much protesting, we're standing in solidarity with our neighbors and our friends and those that are ready and willing to get back to work responsibly and smartly. So come, behave yourself, and have fun. We're probably going to sing a few patriotic songs and just try and send a positive message out there that we can be responsible and that we can do this as safely as possible and start to get back on our feet as a society and an economy.
Jamestown's protest will take place at 3 o'clock today at Dow Park across from the James Prendergast Library. Protesters are asked to stand at least 6 feet apart, wear red, white, and blue, bringing flags, their voices, and signs. Also note that demonstrations are taking place at the Legislative Office Building in Albany, in Buffalo, Rochester, Syracuse, and in New York City. WNY News Now plans to have reporters at that protest and will be streaming live here on Facebook and on our mobile app. Well, hopefully everybody is having a great Friday, and we thank you so much for joining us here for WNY News Now. Got to say hello to Cody. Hopefully you're doing well. Good to see you. Good to see TR on the broadcast. Hello to Joseph, Brenda, Joanna, thanks so much for being here. Good to see Donna and Monica as well. Hopefully everybody is having a good day. Now let's get a check of our First Defense weather forecast, and that's where we find Chief Forecaster Dakota Hunter. Happy Friday to you, Mr. Hunter.
Happy Friday, Jay, and happy Friday to you. We made it to the end of another work week, or should I say another week. And yeah, you can see the Sky Vision camera from downtown Erie shows you the fog. There is fog abode mainly near the Lake Erie shoreline today. 45 is the current temperature with that dew point of 44. When the temperature and the dew point are close together, that's a prime environment for some fog. Now we have some light returns that's moving southward. Yeah, I'm not so sure if a lot of this is actually falling. Again, there might be a few scattered showers within that, but the majority of the day should be dry. It's actually starting to fizzle out as it's actually moving north to south today. And so the majority of the day should look like this. This is the News Now cam, shows you mainly just overcast skies downtown. This is what you're going to expect today. 47 is the current temperature at noon hour at the airport, with a west wind at 12 and the wind chill is down to 42 degrees. We are still below average for this time of the year, and it was a below average day yesterday. 52 was the high yesterday, and 42 was a low this morning, a 10-degree difference there. 88 and 19 are in the record books for this date. So through the afternoon, just lots of clouds, mainly just complete overcast through the day. There might be a chance for an early afternoon shower or sprinkle, otherwise just mainly dry, cooler. And again, there's that fog chance mainly near the Lake Erie shoreline. 48 on the highest hills to 52 near the shoreline, with a west wind averaging 5 to 10. A better weekend is on the way, but then it turns cooler once again for next week. We'll talk about it in a few. Justin?
All right, Dakota, thank you very much. Coming up next, Cattaraugus County's health director joins us live to talk more about his county's COVID-19 outbreak and an interesting occurrence in a case that was identified as positive yesterday. Stay with us.
With coverage that matters, this is WNY News Now.
EagleZip.com is your local one-stop shop for all of your home and business computer needs. Located on Fluvan Avenue Extension, just outside of Jamestown, EagleZip.com sells and services all brands of desktops and laptops, as well as servers and network equipment for your business. All new computer sales include transferring your data from your old computer, plus a 2-year warranty. Call EagleZip.com today.
Stop by EagleZip.com today and let us make computers easy for you.
This is Christine Schuyler, Chautauqua County Public Health Director, with a very important message. We need you to make every effort to protect yourselves and our healthcare workers. If you absolutely don't need to go out, don't. If you have a mild cold or flu-like symptoms, with or without a fever, stay home. If your symptoms are severe, call your healthcare provider. Do not go to the emergency room or urgent care. Do not call 911 or go to the ER unless you are experiencing a life-threatening emergency. The best ways you can help prevent the spread of COVID-19 are to wash your hands often with soap and water, cover your cough, avoid close contact with others. Please stay home.
You're watching WNY News Now, your source for breaking news.
And welcome back to WNY News Now. Joining us on the broadcast to talk more about the COVID-19 outbreak in Cattaraugus County is Public Health Director Dr. Kevin Watkins. Dr. Watkins, thank you so much for joining us today.
Thank you for having me today, Jason.
First, I wanted to ask you about the most recent case involving a female resident who was asymptomatic and claimed to not have come in contact with an active COVID-19 case. What does this tell you about the virus and its potential spread in Cattaraugus County?
Well, it tells us that the virus is widespread in Cattaraugus County, and that residents do not have to express any of the symptoms that we are familiar with for COVID-19, which are coughing, fever, shortness of breath, or whole body ache. That a person can be asymptomatic and unknowingly passing it on to others, to their family members, and most importantly, to others in the community.
Now, with a patient that is asymptomatic like that, does it make it harder to perform contact tracing?
Well, no, it doesn't. It doesn't have any effect with us when it comes to contact tracing. Contact tracing is just an interview with the person that ended up being positive, asking them exactly who they have been in contact with for at least the last 48 hours in which the test actually came up positive, or when they became symptomatic.
Now, overall, it seems like the highest concentration of cases appear to be in the northeast and southeast part of Cattaraugus County. Is there a specific reason for that?
Well, that's where our highest population is centered at this particular time, but there is no reason for those numbers that are positive in our county being located in that particular corner of the county. It's just, a number of our cases come in through physicians who have written scripts for residents who are expressing symptoms, or for those who they highly suspect could be carrying the virus. And it just happens to be that population of that corner are coming up positive.
Now, in regards to testing, I know it's still required in many places that community members who maybe are exhibiting symptoms need to contact their primary care doctor before they go to the doctor and then get inspected by them, in a lot of cases now virtually, and then the doctor is the one who kind of writes that testing script, so to speak. Is that still the case in Cattaraugus County, or is there a more broad way of testing people now?
Well, we've loosened the restrictions on who can actually be tested. We are now testing those who are exhibiting symptoms. We're also testing our first responders. We are testing those who work in the medical field, those who are essential workers, who may not express symptoms at all. So they can be asymptomatic and still ask for a COVID-19 test, and we'll offer that test to them.
Now, regionally, there's a lot of moving parts in regards to now reopening our area. Yet New York's pause order still remains in effect. Have you seen any businesses and residents alike following those guidelines over the past month?
Well, we still maintain that we are going to follow the Pause Act here in Cattaraugus County. Businesses are eager to open up, as you will see throughout New York State. But we do know the risk of coming online too soon. Although we only have 39 residents who have tested positive so far in the county, and we don't have a lot of residents who have shown that they have antibodies against COVID-19. I think that our residents and our business owners do know the risk of coming back online too soon, which could increase the number of cases and most likely increase the number of fatalities that we have in the community.
And the governor has been talking about those antibodies and specific antibody testing, and he says that's one of the best ways to kind of figure out where we are statewide and as a community in regards to building sort of a tolerance for COVID-19, even though I know there are health experts out there who says, if you had it once, you could get it again. There's a lot of discrepancies about that. For you and the information you have, do you know if someone contracts COVID-19 and then recovers? Could they get it again, or do they have that tolerance?
Well, we can only go on reports that we have seen for those who have had it in the past and those who have actually had it and then reacquire it again. So reports that are coming out of, say, South Korea or overseas have really illustrated that individuals who have tested positive for this and recovered from it has actually become reinfected. But so what we're assuming is that with these antibody tests is that we have had a number of residents within our community who have actually contracted the virus and have done well with it, meaning that they built up antibodies against it. They didn't have to get hospitalized, or they weren't in a critical state and had to be intubated by it. So it's good to know that for your community, to see exactly what prevalence, how many people in your community have actually been infected by it. That's what the antibody test is going to show us. It's not going to show us specifically whether or not a person is immune against it and cannot get reinfected again.
Now, I know in Chautauqua County, as of late, they haven't begun antibody testing here yet. Have you in Cattaraugus?
Yes, we have. Olean General Hospital has started the antibody testing. Right now, they're doing it just for healthcare workers. So the healthcare workers will come online first to get tested for antibodies, and then we'll open it up to the public sometime, I believe, after May 6th.
Now, in regards to reopening, as a public health official, what is, in your opinion, the best way to reopen while continuing to work to keep spread of COVID-19 to a minimum?
Well, we really have to increase the number of tests that we do for our community. That's going to be the best indicator for us to really identify residents who are positive, isolate those residents from the other community members, and then we will mitigate the spread. So I think testing would be the most important thing that we're going to have to do in order to start to reopen here in Cattaraugus County. And then we want to look at those who have recovered in the community. So far, we've had 24 of our 37 who have recovered. So to us, that's a good outlook for us. But that would be the second thing you want to look for. And then you want to make sure that before you come online, that those businesses have plans to maintain social distancing until we can actually develop or come online with a vaccine against COVID-19.
And we've talked to a lot of people on this program about that very thing, is that the future of our society almost could be changed because of COVID-19, and now people are maybe a little more aware to it. In your opinion, do you think that going forward, say when people go out to dinner or go out in the community, they'll be a little more cautious and we'll all sort of take more note to, okay, what am I touching? Who am I coming in contact with?
Yes, I think that has really come as a huge educational piece that most residents have learned from this particular virus, is that we really must be careful about the things that we about our hands, what we have touched, making sure that we're not putting it in our face, and that we are careful about social distancing. That's become a huge educational piece, and I think our residents are really learning from that as well.
All right. Finally here today, what is your overall message that you want people in the community to know about right now as we continue the effort to contain COVID-19?
I want them to know that there is a lot of work being put into COVID-19 and and that we have researchers out there that are really close to developing a vaccine. It looks like that there is a good outlook on one particular antiviral medication out there right now, and that we are going to continue the fight to reduce the spread of this virus amongst our residents here in New York State. And that as a public health official, that we need to work with our public health officials to understand that the only way to mitigate the spread of this virus is to, for now, hunker down in your homes until we can find a vaccine. And if that is not the case, where you need to get out for some type of exercise or some type of outing, that you wear some kind of face covering when you're out there. And when you return home, that you want to wash your hands for at least 20 seconds. That will help to reduce the spread of the virus.
All right, Cattaraugus County's Public Health Director, Dr. Kevin Watkins, joining us on the broadcast today. Dr. Watkins, thank you so much for your time. We appreciate it.
Thank you for having me.
Let's now get a check of our weather forecast with Dakota.
May 1st, and so let's do a review of April. Where did we go with April? Well, as we've been telling you, April has been chilly. 22 days out of the month were spent below average, where the high temperature for the date was spent below average. Only 8 days out of the month were spent at or above average. So when you calculate this all together, our average high for the month is 49.1 degrees. That is 8 degrees below the normal to where we should have been for the month of April. Again, the average high for the entire month is around 56, 57 degrees, and we fell 8 short. A lot of those, and again, a lot of those below average days added into that, and the cold air looks like it's going to stay for a while. Hey, Olean got a soaking, over an inch of rain over the past 24 hours. That all came yesterday. Ishway in Cat County, 0.77. Mayville, 600ths of an inch. Fredonia at just over half an inch. Jamestown officially 300ths of an inch. And Falconer, a quarter of an inch. So you can see where the heavier rain was yesterday, but the rain is done for today. 47 here in town, 50 over in Randolph, 45 Mayville, 44 Fredonia, and 46 over in Erie. So temperatures are not as warm as they have been the past couple of days, but temperatures will remain below average for a while. There's some fog out there right now. Erie at 3-mile visibility right now. There's some fog mainly near the Lake Erie shoreline, although Dunkirk has 10-mile visibility and Buffalo at 7-mile visibility right now. So there's going to be some patchy fog near the Lake Erie shoreline today. So keep that in mind if you're there, or if you're going out to that particular area, just keep that in mind. There's going to be some fog, especially through the early afternoon. The storm system that we had has exited off to the East Coast. This is the storm that kind of impacted us over the past 24 hours, now up into New England, but we're left with the cloud cover with that west to northwest wind flow aloft. And because of that west to northwest wind, that's going to keep the clouds around, and it's also going to keep our temperatures cooler. Let's take you through Future Scan. The model does show the idea of maybe a scattered sprinkle, maybe across the inland areas of the southern tier. Otherwise, that's it. Dry today, dry through tonight. Most of tomorrow is going to be dry. It's not going to be until later in the afternoon into the nighttime hours we start to see a few scattered showers with a weak frontal system moving our way. Showers will start to increase overnight on Saturday. And again, when you get into these darker colors, there might be a chance for an isolated thunderstorm within here. No severe weather expected. But and again, the rain will continue. It'll continue Saturday night. Early Sunday, you may see a shower, but then Sunday should be mainly dry in the afternoon. So let's talk about it on the weekend weather. Let's give you a little bit more details for the weekend here. So we're going around 62 on Saturday. And again, Saturday, the day should be mainly dry. It's a typical spring-like day. This is right around average for this time of the year. And showers will arrive later in the day. Now on Sunday, though, it will get a little bit more dicey. 25% chance of rain. And again, the main chance of that's going to be in the morning hours. It's milder. And again, with a morning shower, otherwise sun and clouds for the afternoon. And again, this is the average high around 65. Your temperature is going to vary depending on your actual location within the region. So tonight, the clouds will break overnight. We may actually clear out, especially overnight. Turn on those heaters once again if you haven't already, because the lows are going to be back down into the upper 30s to lower 40s for most with a west wind. You want them? I've got them. How about the next 7 days of your life? There's the weekend. We talked about it. Heading into early next week, a big upper trough digs into the region, brings cooler air back into the region once again, but high pressure builds in, which means Monday all the way through Thursday, we should be mainly dry with a good supply of sunshine, both basically every day, with temperatures down into the lower 50s. News continues 24/7 at WNYNewsNow.com and also on the mobile app. We will see you right back here Monday afternoon at noon. Have a good weekend and stay safe.